are going to learn schistosome, and it's a kind of flux. On the right, you can see some of the pictures, and the first one is showing adult form of the schistosomes, and this is a couple, and this couple lives together. Outside is a male, and it looks like a roundworm, but actually it belongs to the flux. It's flat, and it's folding itself up, so it forms a kernel in the middle, and you can see in the middle there's some slimmer ones, and this slim ones is actually the female schistosome. So the female schistosome actually live inside in this kernel. So this female and male schistosomes actually folding together, and this couple just holding them together hand in hand for their lifetime. And all this time long, they just poop out many of the eggs, and they do nothing but pumping out eggs. And in the middle, this is a form of a Saccharia, which is the larvae stage, which is one of the larvae stage. And the Saccharia is the stage that can infect human beings. So they swim freely in the water, but they can sense the warmth and the light. And anytime when people passing by, and because in the water temperature is around 22 Celsius, and the human body temperature is 37 Celsius, and they can sense this warmness and swim in towards human being, and then get inside the body through the skin. And at last is, you can see, it's the schistosome egg, and the egg is in the tissue, and you can see fibrosis is building up around the egg. And this is actually one of the reasons that schistosomiasis is very serious when the worm burden is heavy, because as we mentioned, schistosome can lay thousands of eggs per day, and the egg burden can be very heavy, and later on it can be very dangerous for human being. And next, we are going to go into details for the introduction, and we are going to learn about the epidemiology, and also we are going to learn about the form, what does the schistosome looks like, and then appreciate the life cycles to understand how to break the cycles, and next about how to make the diagnosis. And the clinical presentations varies with phase of the infection, and then we are going to talk about the diagnosis, and last we are going to talk about control and treatment options. Schistosome, we call them blood fluid. The disease, the causing is called the schistosomiasis, and around the world there are many people getting infection, and there are many species of schistosome, and the Schistosome japonicum is usually found in Asia, many countries, and in China it was also found. And there are there are 6 species affecting human being, and the first three are the most medically important ones. And although the eggs looks different, and you can see they all have a spike, but the spikes looks different, and a little bit different among them, depending on which species, and their eggs may rest in different places, and you need to test different tissues to find the eggs. But commonly, the life cycle are very similar, and the adult worm all share the same shape. That there's a male one, that's wider, and inside there's a female one living inside this kernel. And this is the epidemiology. You can see the 3 different species that can be found in different places. And the Schistosoma masoni was found in South Africa and in Africa, and also in South America. And Schistosoma hematobium was found mainly in America, and Schistosoma japonicum is found in Southeast Asia. And all 3 different species, many people are at risk. This is another map showing different color, and the different color indicate different species, and in which area in the world. And this is a part of the China map. It's showing the in 2013 schistosomiasis epidemic situation in China. And the 3 species of medical significance, they can be found in different parts of the world. Schistosoma masoni was found in America, Arabia, and South American and Caribbean countries. And Schistosoma hematobium was found in America, Africa, and the Middle East. And Schistosoma japonicum was found in China and the Philippines, southern Japan, and some central Sulawesi. And they have different homing preferences. And the first one, Schistosoma masoni prefers to live in the adults prefers to live in the mesenteric veins, and Schistosoma hematobium prefers to live in the vesical plexus of bladder, and Schistosoma japonicum the adults prefer to live in the superior mesenteric veins. And now let's look at the morphology. And this is freaks that have 2 different gender individuals. And in the male, there's a kernel, and the kernel is called gynecophoral kernel. It's in the male, and male and female need to couple together, and it's after they couple together, and then their hormone will be excreted, and both gender will develop into adults. Otherwise, they just stay in the larvae form. And these freaks, they don't have the pharynx, and there's some slight variations between different species. Also, from this picture, you can see the 2 different gender, they have different colors. And the male one is more pale white color, and the female one is longer and slimmer, because it need to live inside the kernel. And the color for the female is darker, because even though both of them are living on the RBCs, they live in the vein system, but the female one need more of the RBC to need more energy, because the female one have the shoulder the responsibility to lay eggs, so they have more of the RBCs inside. That's why they have the darker color. And this is the picture showing the adult worms, and the female one is slimmer and longer, and male one is wider, and they have the kernel, and both of them have two of the suckers. So one is the oral sucker, and the other one is a ventricle sucker. And so, unlike other trematodes, schistosomes have separate sexes, and the male one is formed in the is flat, and they fold their body into this shape. So there's a kernel in the middle, and the slender female worms will reside in this kernel. And you need to remember the name. Is this kernel is called the gynecophoric kernel. And this one, you can see the color for the female is lighter, and the color of the color of the male is lighter, and the color for the female is have the darker color. And the adults is you can see with your naked eyes, they are about 1 to 2 centimeters long. This picture is showing the male adult worm, and it's slightly larger, and you can see the how long it is, and this in middle there's a gynecophoric kernel. The female lives inside, and each species, each individual, they have 2 suckers, and both of these suckers can help them to maintain where they prefer to live in, because they live normally in the blood vessel, because they call the blood fluids. They are living in the blood vessel. They need to hold their position. So the suckers are very strong to do their job, to attach to the blood vessel. This one is showing the picture. This picture is showing the female adult worm, and they are 2 centimeters long by 0.4 millimeter. And the egg, you can see the colors are getting darker, and there are eggs in the uterus, and you can see they have varied numbers of eggs inside. And for the female, the color is darker, and because they need more of the RBCs to digest, because they need to lay eggs, they need more energy, more nutrition. This picture is showing the Schistosoma japonicum egg, and for this one, the egg is oval or spherical, and is in a pale yellow color, or is yellow brownish color, and there's a small knob, and inside there's inside there is a mature meracidium, and it's embryonated. So inside you can see this larvae, and when it's mature, it can be discharged and into the water. And this picture is showing eggs of 3 different species. And for the Schistosoma hematobium, the eggs can be found in the urine, and it has a apical spike or a snob. And for the Schistosoma mansoni egg, it can be found in the feces. And for the Schistosoma japonicum, the eggs are also pooped out in the feces. So for comparison, you can see the size the shape are different, and also for the place where to detect, the eggs, they're also different. Hematobian was found egg is found in the urine, and the other ones are found in the species. Are found in the feces. Sorry. Next, we are talking about the Meracidium. Meracidium is the one that in the larvae form, it's in the egg. Then the egg is embryonated, and then later on the matured larvae will be getting out of the egg. So this is the stage of the Meracidium. It's a swimming larvae, and they can all over the body. You can see there are some of the, it's very furry, and it's free swimming in the water. And next, you are looking at the sporocyte. The sporocyte is in the long pocket shape, and there's no mouth or furnace with and inside are the stem cell and developing sarcarias inside. And this is the form that developing in the snail, which is an intermediate host for the freshwater snail. Is the intermediate host for this blood fleek. And the next stage is the sarcaria, and the sarcaria is the stage when they are getting out of the freshwater snail, and they will get inside the water, where they are free swimming, and they can sense the light and sense the temperature, because in the water the temperature is low, and later when people are walking or swimming in the water, and they will get inside, and you can see it has a tail, and so it can shake the sarcaria can shake their bodies, and then at the head, at the top, there's a protease, and the protease will help them get inside the body, and then the forked tails are left outside the skin, and only the head get inside the body. And within 3 hours, they will find the blood vessel, and eventually they will swim inside the body and goes to the place where they want to go. And this is a picture showing the intermediate host, and it's a specific freshwater snail. Its name is called Oncomylania. This is the only Oncomylania is the only intermediate host for blood fleek. As this kind of freshwater snail is commonly found in lakes or along the river, and usually you can also find them in the rice field. And after the eggs were pooped out into the water, the Meracidium will be swimming, and they get outside the egg and get inside this freshwater snail, and after stage of the sporocyst, and then into the sarcaria, and at the sarcaria stage, they will be getting out of the water. They will get out of the water. And next, we are going to see this life cycle, and we'll start from the middle part, where they get into the water. So different species they can find in different places, and these two, Masoni and the Japanicum, you can find them in the feces, and Hematobian, you can find the eggs in the pee. So they get out of the they get out of the system and inside the water, and the and later the matured embryonated ones eggs, the eggs will hatch, and the meracidium will get inside and then swim into the freshwater snow. And freshwater snow are of different species, and this one is the one we talked about. And and they penetrate the snow tissue, and inside the snow tissue they will develop, and the spore cyst is in the developing in the snow, and they have successive generations, and then they will develop into Saccharia, and the Saccharia will be released into the water, and they are free swimming. And at this time, when they find some when they find people swimming or walking barefooted in the water or in the rice field, or other mammals, cats, cows, in the water, and they will find them and get inside. So the Saccharia will penetrate the skin and get inside the human body. And at this time, the Saccharia lose their tails during penetration and become the Schistosoma. And this is another form of the larvae, and they will get inside the circulation system, and after some time, they will, after about 24 days, they will after 3 hours they will migrate, and after some time they migrate to the portal blood in the liver, and mature into adults. And so from they get inside the body until the first generation, after first generation of the adults who lay eggs, it takes 24 days. And it's only, remember, the larvae blood fluid need to find each other. Female, some of them develop into female, some of them develop into female. It's only female ones coupling with the male one, and their hormones will develop, and then they can develop into adulthood. And if they just stay singly, they will stay in larvae stage forever. And they need to hold together to develop into adulthood. And once they hold each other, they find their love of life, they will hold each other for lifelong, and until they die, they will just hold together. And after they hold each other, they do nothing but lay eggs. So they just lay eggs day after day, and they have many eggs. And paired adult worms migrate to different places. Some of them are homing to the mesenteric venues of the ball or rectum, and lay eggs, and they will be laying eggs that circulate to the liver and shed in stools. And this is the same for the Masoni and Japonicum. And then for the Hematobium, they prefer to live in the venous plexus of bladder, so that's why you can find the eggs in the urine. And this is a life cycle of the Schistosoma. So the adult worm reside in portal systems, superior mesenteric vein, and the eggs germinate as they pass through the vessel wall into the intestine or bladder, and excrete in feces or in the urine. And under optimal conditions, the eggs hatch and release meracidium in fresh water. And for the Japonicum, there's only one intermediate host, which is a oncomelani, and they can be found in fresh water. And the larvae Mericidium hatches out of the egg and swim about until it find the appropriate intermediate host, this freshwater snail. And after two generations of multiple multiplication in the snail, the forked-tailed Sacaria emerge into the water and infect another human, and they don't have the metasacaria stage, and there's no radia, but two generations of the sporocyst. And after they were released from the snail, and the infective stage is a Sacaria. The Sacaria is swimming, and then they can sense they're very sensitive to light and to temperature, and once people are walking by, they can find the host and penetrate the skin to the human or other host, and they shed their forked tail and turn into Schistosoma. The Schistosoma migrate through several tissues to stage to their residence in the veins. And adult worms in humans resides in the mesenteric venues in various locations, which at times seems to be specific for each species. And for the Japonicum, they're more frequently found in the superior mesenteric vein during the draining the small intestine. And for the Masonian, they were more often found in the superior mesenteric veins draining the large intestine. And for the mode of infection, thereby through skin penetration of the forktail-like Sacaria. And the migration route for the Sacaria is first they stay several hours in the skin, and then they need to convert into Schistosoma, and they will find their way into the subcutaneous venous, and then into the pulmonary circulation, then to the heart, and then then they join the systematic circulation, and last they will go to the portal vein and into the mesenteric vein. And in about 3 weeks, they will mature and reach the mesenteric or the bladder vessels, where they live and ovulate for the duration of their lifetime. And both species can occupy either locations, and they are capable of moving between sites. So it's not possible to stay. So it's not possible to state that which species specifically only in which location, because they might wrongly live in other tissues, but they can stay there, just like that. And hematobium more often occurs in the venous plexum of bladders, but it can also be found in the rectum venous. And the female ones deposit eggs in the small venous of the portal and the perivesical system, and the eggs are moved progressively towards the lumen of the intestine, and later they will be eliminated with the feces or the urine from host, and the human contact with water is thus necessary for infection by schistosomes. And the various animals such as dogs, cats, rodents, pigs, horses, goats serve as a reservoir for Japonicum, and dogs for Mekongi, which is another species. And next, we are going to see how they can injure the body. And there are different species shows different pathology. There's Katayama fever, um, pre-sinusoidal X granulation, um, Siemens pipe stem periportal fibrosis, portal hypertension, occasionally uh, embolic egg granulomas in brain, or they can be found in the spinal cord. And for the hematobian and the schistosomiasis includes hematuria, scarring, calcification, squamous cell carcinoma, and occasionally there's embolic egg granulomas in brain or spinal cord. And usually there are three different stages for the disease to progress. First, there's a first stage, which is early stage, usually in the first 4 weeks after infection, and there's itchy and local edema because of the allergic reaction of the penetration of the sarcaria into the skin. So there's itchy, and there might be type 1 or type 1 hypertension, or there's and then there might be fever, headaches, or abdominal pain. And then there's a second or intermediate stage, which can last for 3 months or more. And there may be chills or fever, cough, urticaria, and arthralgia, lymphadenopathy, splenomegaly, abdominal pain, diarrhea. And there's might also be leukocytosis, marked peripheral eosinophilia, elevated levels of IgM, IgE. This is common in the Katayama syndrome. And then there's a chronic stage, which is usually after 3 months. And this is because the eggs are matured, and then there's a soluble egg antigen, which is also called SEA. The eggs, this antigen, they will start the T lymphocyte mediated eosinophilic granuloma, and finally a final fibrosis. And there's portal hypertension, there's splenomegaly, and ascites, which is a very late stage. And the first stage, there's a swimmer's itch because people usually are swimming when they get the sarcaria getting inside the body. So this is often called swimmer's itch, and this is due to physical damage of the skin by the protease and other toxic substance secreted by the sarcaria. And the host might develop both type 1 and type 4 hypertensity reactions to schistosome secretion and egg constitutes. And embryonated eggs may cause collagenase mediated damage to the vascular endothelium. And there's host immune responses, and both hormonal and cell mediated ones can happen. IgE and eosinophil mediated cytotoxicity has been suggested as a mechanism of killing the adult worm. And then we are going to talk about the schistosomiasis. It's an immune disease, and all stages in host may be pathogenic, and no matter it's a Sacchardia, schistosomal eggs and adults. So all and all stages there's might be disease and immune response related to them, and the main pathogenic factors is the egg, and as we mentioned, the schistosome lay thousands of eggs per day, and these eggs were deposited in important organs, for example the liver and the intestine, and they accumulate, and they will form there's a form of the egg granuloma, and later on the tissues were jammed, and there's and so there's accumulation of the eggs, and also there's ectopic migration. For more often we can find the eggs accumulated in brain and tissue, and for the skin there's swimmers itch. It's just for a very short time after Sacchardia penetration, and there's type 1 and type 4 allergic reaction, and then there might be transient fever and coughing. This is the same as this is exactly the same as the hookworm and the Ascaris infection, which they have this very short time of living inside the lung tissue, and during this 2 weeks there might be coughing, fever, and this is same, and this is a mechanical damage and allergic reactions to the metabolite materials of the Schistosoma, and then there's a phlebitis caused by the adult swarm, which is rare but can happen, and glomerulonephritis caused by the type 3 hypertensity to the metabolic materials of the adult worms. And we'll be putting our attention to the egg granuloma, and the eggs can produce a granuloma formation as a delayed type. It's a delayed type hypertensity. It's type 4 hypertensity reaction, and although eventually they result in severe pathology, it appeared to be a necessary protective host response against the component of the SEA by the entrapped eggs. And granuloma actually is the eggs in the center area, and then outside are several layers of the T cells and B cells, and also macrophage and giant cells and epithelioid cells, mast cells, etc. And all these cells can prevent the SEA to getting in touch with the healthy tissue. So this is the positive. So this is the positive part played by these reactions. And then there's fibroblast. They can mediate the collagen deposition in the granuloma, leading to the fibrosis, and this will eventually result in the hepatosplenic disease associated with the schistosome infection, and this is a downside for the egg granuloma. And this is the picture showing a rabbit infection. So this is the animal model in the rabbit. Sorry, this is a mesentery. And in the middle, you can see the mesenteric veins, and the white thing is not very. You cannot see them clearly because for the male the color is whiter, and the gray and black ones are the female, which is much easier to see. to be seen. And these are the adults living in the mesenteric veins. And this is also the rabbit liver tissue model, and you can see a lot of the fibrosis, lot of nodules on the surface of the liver, and so the liver is not very smoothly. And in this liver, the Schistosoma X granuloma was accumulating, and at the end of the portal venous branches and the sinus veins. And if heavily infected, such as this picture showing, the heavily infected fibrosis will occur and surrounding the portal veins, and there will be lumps on the surface, on the liver surface. And this is a HE staining showing the tissue, and you can see the in the middle is the egg, and then surrounding tissues are forming each layers and surrounding by different T cells, B cell, master cell, etc. And then granularly there's a knot forming in this, and this is how the fibrosis is starting to form. And for the symptomatology, so there's according to different stages, there's acute schistosomiasis. The acute stage is called the Katayama syndrome. So there's fever, and this is usually observed either in person residing in the endemic area at the time of their first exposure, or in infected person who live elsewhere and enter the endemic area for the first time. And the onset of fever is usually over more than the onset of fever is averagely is 41 days, and other symptoms include the rigor, sweating, headaches, cough, general muscular pain, and GI disturbance, such as loss of appetite, etc. And then there's a chronic schistosomiasis, and most chronic patients are asymptomatic, and sometimes they can show the hepatosplenomegaly. And then there's advanced schistosomiasis, and the enlargement of the spleen is continued, and then there's portal hypertension, ascites, abdominal collateral vein and dilatation, and esophagogastric vessels, and then a few severe manifestations such as the upper gastrointestinal bleeding, etc. And also there might be sudden death of patients of late stage. And then there's Salmonella Schistosoma syndrome, and also some of the schistosome may some of the adults or eggs may show in wrong places. So this is a ectopic schistosomiasis. And this picture is showing the penetration of the Saccharina is causing the swimmer's itch. This is a dermatitis syndrome. Dermatitis is mild in initial exposure, but if the patient was infected repeatedly, and then the hypertensive erection may be severe, and there might be a sudden outbreak, and then itchy and breaking of the skin may lead to secondary infection, and the rash can sometimes be very easy to be misdiagnosed. The symptoms of the schistosomiasis are primarily due to a reaction against the eggs and include splenomegaly and lymphadenopathy and diarrhea. And in the bladder, they produce granulomatous lesions and hematuria, and sometimes uh, urinal occlusion. Most bladder cancers in endemic areas are associated with chronic infection, and in the intestine, they cause polyps formation, which in severe cases may result in life-threatening dysentery. And in the liver, the eggs cause periportal fibrosis and portal hypertension, resulting hematomegaly, splenomegaly, and ascites. And gross enlargement of the esophageal and the gastric vein may result in their rupture. And Japanicum eggs are sometimes carried to the central nervous system and cause headaches, disorientation, anemia, and coma. Eggs carried to the heart produce arteriolitis and fibrosis, resulting in the enlargement and failure of the right ventricle. These pictures are showing a very typical distension of the abdomen. For the diagnosis, so diagnosis is based on the history of residence in the endemic area, and you can ask the patient whether they underwent the swimmer's itch and other symptoms. The eggs are very characteristics and confirm diagnosis, and the hemoglobin eggs were found in the urine, and Manzoni and Japanicum eggs can be found in the they have the spine on the side, and the Japanicum egg has a spine on the more round and a big spine on the side. And there's immunological test for reference. For example, this is a RCHR. So basically, you take some of the Saccharia put them in the slide, and then you take some of the patient blood, and if there's the reaction, there will be some of the gluten-like things formed on the Saccharia body because there is a complement in the patient blood, and so you can see this glue-like things at the circling the Saccharia. And then there's also the test using the eggs. So first you put some eggs on the slice, and then you take the patient blood and mix them together. And later, and after some time, after some time, you can, under the microscope, you can observe there's something comes out, like there's some reaction, and there's a layer of the thing forming outside the eggs. And this is a test using the eggs. It's called the COP. So these are the tests of using the immunological test. And in many parasitic infections, the parasite or their eggs are detected by our immune system, and because they play at the role of the antigen. And if the parasite is too large to be recognized, the host immune system will attack this foreign invader by producing inflammation and fibrous scar tissue around the parasite or its eggs to wall it off from other tissue. And this occurs in Schistosoma eggs, liver fluid infection, and lung fluid infection. And for the treatment and control, Praziquantel is effective against all the species, and you want to educate people to walk barefoot or swim in the endemic area water, and also you want to safely dispose the feces, and you want to avoid them from contaminating the water. And we also as the three Schistosome species, they have specific intermediate host, so you want to properly reduce the specific snail species, and we can introduce some of the other animals as a predator to eat up the snail, and also we can apply some of the killing fish, and introduce other predatory snails or crawfish, and then this cost money to bring clean water into the. We can cost some money to bring clean water into the village, and use some other livelihood around the waters, like the crop irrigation, fishing, washing clothes, bathing, and to reduce the chance of getting infection. And this is a picture showing some of the people. They still have this lifestyle that wash clothes in the river, swim in the water, and if this is endemic area, you want to avoid doing this. So you need to educate people to not do this in the endemic area. And so far, there's still no vaccine available. So scientists are still taking their time to develop vaccination. And there's use of drug containing lotion rubbers on skins to prevent Sakarya penetration. This has been proven to be okay. So it has some effect to prevent the penetration of the Sakarya. And this is a table showing differences between adult Schistosoma and some of the characteristics in different Schistosome species. And this is so much for the introduction of the Schistosoma.